The Center for Conscious Caregiving is a nonprofit 501c3 charitable organization located in Brick, New Jersey. Our mission is to advance conscious caregiving for self, other, and the community through education, mentoring, and self-care healing practices. Our vision is to empower caregivers and transform caregiving. Why? There are multiple forces creating a perfect storm for the caregiving future. Our aging population, large disability population, substance abuse epidemics, violence and trauma, not to mention that healthcare and educational institutions are in a state of crisis. In 2010, the Semele Institute crafted an overall strategic plan titled A Wellness Initiative for the Nation, which proposes widespread training of community-based health and wellness coaches. These coaches would utilize integrative healthcare practices to work on chronic disease prevention. We believe that the most engaged stakeholder to assume this coaching role for our families and communities are both the professional and family caregivers. But to assume this role, we also believe that individually and culturally, we need to first instruct and mentor caregivers in assuming responsibility for their own care. Thus, we must teach them how to care for themselves. The values espoused by our organization are trust, integrity, heart-centered leadership, respect, and authenticity. The strategic intent of our organization is to develop an integrative wellness and coaching center to support caregivers and their families across the lifespan. To do this, we will create first a vocational training program to certify personal and family care coaches. Secondly, an integrative practice center with a variety of integrative practitioners that can be available on-site, in the home, or at the workplace. And thirdly, we envision a membership-based community center that offers affordable classes and workshops focused on health, healing, and the use of self-care practices. We envision that our vocational training program will be utilized by individuals, professional practitioners, family caregivers, along with academic institutions and healthcare organizations. We envision our personal care coaches would refer clients to various integrative practitioners based on the needs identified in their care plan. These practitioners, again, may be located on-site or be contracted out to businesses, healthcare, or schools. Our membership-based community center would have a variety of self-care practices and health and wellness promotion classes that are available for reasonable cost, either in a classroom setting or online. These self-care practices and promotion classes are categorized by physical, emotional, mental, or spiritual tracks. FAQs. What are personal and family care coaches? They're trained practitioners who assist professional and family caregivers in developing personal care plans. Personal care plans are focused on helping caregivers learn and practice self-care. What is personal and family care planning? Personal and family care planning is a structured process in which the caregiver identifies the quality of life they wish to improve for themselves and/or their family. They create specific intentions to improve their well-being in the physical, emotional, mental, and spiritual aspects of their life. They then decide what self-care practices best suit their lifestyle and incorporate those practices into their plan. Ongoing evaluation and validation occurs with caregiver, coach, and the peer group. What are self-care or personal care practices? A practice is any activity that we place our attention and intention on. Watering your plants can be a practice if you are putting your attention and intention on the action. It takes practice for most of us to do that, but when we do, we become present. And being present is key to improving our quality of life and well-being. Leadership development. Personal and family care coaching must be a part of the professional environment. Therefore, the Center for Conscious Caregiving will become the model by using the model as an organizational tool. Core staff at the Center for Conscious Caregiving will create their own personal care plans as part of the organizational quality assurance process. Self-sustainability. With the use of fundraising, space rentals, grants, community awareness events, and eventual fee-for-service programs, we expect to reach a self-sustainable status within the next 3 to 5 years.